organizations platforms under the BIRAC Regional Entrepreneurship Center to attract, identify, and nurture game-changing deep science ideas with business potential. And joining us today is one of the winners at NBEC this year, Mr. Gaurav Parchani, co-founder of Dozee. Gaurav, thank you so much for joining us. And I had the pleasure of actually watching you speak at NBEC this year, and it was quite a compelling presentation. So it's not surprising that you ended up one of the victors at the competition this year. So how was the experience for you, and how encouraging was it for you and of course the team at Dozee to be validated in this way?
Absolutely. I think it's a national forum. So to be recognized as one of the top innovations or the upcoming top innovations in the country in the field of life sciences and biosciences, it's one of the great feelings. Obviously, it's a great validation for the work that we are doing, that we are on the right track, especially for the team at Dozee. What we had applied for was an incremental innovation to Dozee, which was essentially non-contact blood pressure. We've been doing non-contact vitals for a long time now and deployed in hospitals. But non-contact blood pressure is a game changer. This is one of a kind in the world and the first one in the world. So yeah, it feels amazing to be recognized and in that sort of a cohort. And it's a great validation and a morale booster for the team as well to keep at it, because I think it kind of validates that we're at the right track.
Absolutely. And the thing is, I think your tagline is, that Dozee never sleeps, but I think you allow a lot of healthcare professionals at least to be able to sleep a little easier, knowing that, okay, their patients are being watched carefully without a staff being stretched constantly around the clock. So can you tell us a little bit about how this works exactly for people who may not know how Dozee exactly works? And what are you talked about blood pressure, what are the other spheres you work in? How exactly does this work?
Absolutely. So I'll just introduce Dozee a little bit.
Sure.
We make non-contact continuous remote patient monitoring solutions combined with an early warning system. What essentially that means is that our sensors that we make for hospitals, and these are deployed inside hospitals for remote patient monitoring inside hospitals. We even have home versions as well. But focusing on the hospital one, we have sensors that go under the mattress. They don't even touch the patient at all. Automatically, without the requirement of anybody in the staff, the nursing staff or doctors or the rapid response team or anybody, the device automatically keeps on working, capturing all the vibrations that a human body produces. Out of that, we extract biomarkers and vitals, heart rate, respiration rate. I mentioned about blood pressure, movements of the patient, activity, and so on and so forth. And we combine it with a platform where we can attach different sensors as required. So you can attach an SpO2, you can attach an ECG device, you can attach multiple other things, and the system becomes better and better as you keep attaching this. All of this data comes to the cloud, and it becomes available to the nursing staff on the nursing station, or even in the doctors in the form of their smartphone applications. Hundreds of patients in one shot can be seen. What is the status, how they've been doing for the last 1 hour, last 24 hours, last 48 hours, and from the time they've been admitted to the hospital care. Not just this, on top of this, there's an early warning system that keeps looking out for these patients and keeps looking for signs of early deterioration. So as soon as a patient is identified, a notification is generated to the relevant nurses and doctors who are associated to that particular ward in the hospital, and an escalation is made so that an early check can be done. And based on that check, the doctors can identify whether this person needs urgent care, medication, or needs to be shifted to an ICU bed or something like that. So essentially, we are creating these step-down ICU systems in a hospital, converting any bed into a step-down ICU bed within minutes at a fraction of the cost of an ICU bed, and making this available to each and every hospital as we go along.
Absolutely. Well, that certainly sounds like a game changer in so many ways. And if I can ask, how many hospitals are you currently present in India? I read some staggering figures, I think, on your website, which says that 75% of hospital deaths can actually be avoided. You're using this. So can you break that down for us as well, please?
Sure. I'll answer both the questions. So we are present in approximately 300 hospitals today in India. In fact, we've just begun our international expansion with some of the African countries as well. Very soon, I think in the next quarter or so, we also hope to be in 4 to 5 countries in Africa, in Bangladesh as well. But in India today, we have 300 hospitals that are working with us, both public and private. Approximately 8,000 beds in all of these hospitals are currently monitored with Dozee. And we want to double this very, very soon in the next 6 months and get more beds under the care of Dozee. From a monitoring standpoint, right, you have to realize that in India, we have 20 lakh hospital beds today. Right. Out of these 20 lakh beds, the shocking part is that only 1.25 lakh are ICU beds, where you have continuous monitoring today, right? Which is 5% of the beds. Right. In COVID, we saw that there was such a shortage of ICU beds, right? And primarily, we realized that it's not a COVID problem, but it's been a problem always that we've had. And it's primarily not an equipment problem. It's a manpower problem, right? So today, in ICUs, one of the criteria that WHO puts is that you need to have 1:1 or 1:2 nurse to patient ratio, right? An ICU shift is like almost a 6-hour shift. So to imagine that for every ICU bed, there are 4 nurses in a day that are taking care of that bed, right? And this is what exactly stops us from increasing the ICU beds. Yes, as a country, we've committed that from 20 lakh hospital beds in the next 5 years, we'll get to 40 lakh hospitals. And I'm very sure that we will get there from an infrastructure perspective. But I'm very sure that we are not even doubling the number of nurses as well, right? These ratios are even going to go bad. Today, outside ICU, it starts anywhere. If you're in an urban area, if you're in one of the top hospitals, it starts at 1:8 and 1:10. But as you keep going down to public hospitals, keep going to rural areas, it goes even bad. Like, so 1:20, 1:25, right? That is basically the issue. And what we are supposed to do, right, outside ICU for checking on patients, since we cannot implement continuous monitoring, right? Even if we had all the funds to put continuous monitoring in all the beds, right, traditional patient monitors, we can't expect one nurse to look at 20 screens, right? Or 30 screens simultaneously. So we need to make this whole system connected. But there is a tremendous amount of cost that traditional systems, a land-based system, that incurs on a hospital infrastructure. And that is where we need to kind of get creative around it. We have cloud, IoT, Internet of Medical Things today that we need to leverage. And this is exactly what we do at Dozee. First, we make the sensors contactless so that intervention is not needed again and again. You don't need to connect wires again and again. Second, we make it completely cloud enabled. So this is exactly where one nurse now can look at 40 patients on a screen, right, on a digital monitor, and can go to the patient that needs her the most, right, which is the highest
priority.
And this is where the triaging happens, and this is where we kind of implement better patient workflows. And in case there is an alert, there's a straight notification to the patient, the hospital rapid response team or the emergency response team to go check on the patient and check what is happening, so that proactive care can be given and proactive transfers to ICU rather than a reactive one, right? Today, without this system, we have spot checks that are being done, right? 4 to 6 times a day, between every 4 hours or 6 hours, depending on hospital protocol, a nurse has to go and record these vitals manually and put it on a piece of paper, right? We digitalizing all of this. And second, imagine that if I could only give you 4 photographs of a person every day, right? Would you be able to tell about their life? The answer is no. But if I give you a high definition video of their 24 hours, would you be able to do it better? The answer is yes, right? And this is exactly what we do in an analogy standpoint, that instead of like just 4 snapshot, you have minute by minute high quality vitals data, which you can rely on. There is no chance for a manual error or something like that. And it's completely digitized altogether automatically without you having to do anything. Like usually wherever we're seeing digitalization in India, the nurse is recording it, putting on paper, and then later going and doing an entry, right? This is not only saving their life, this is actually increasing their burden, right? That digitalization.
Absolutely.
Implementing such a solution, which is automatic in nature and doing it in a bulk manner, is essentially helping the nursing staff do it better. We actually did a time motion study where it takes approximately 7 minutes for one nurse to take readings on one patient and put it on paper and charts and all of those things. Now imagine in a 1:20 and nurse to patient ratio, the nurse in one round will take 140 minutes. And this by 4 times or 6 times for different nurses during the 24-hour schedule. It's tremendous amount of time that is being spent on manual things. So what we're essentially doing is we bring down this by 80% so that the nurse can focus on the care aspect and the human aspect of care rather than the mundane aspect of noting down, measuring, and so on and so forth, that machines can do. So that's essentially how we help nurses to help essentially in saving time, focusing on the care, and at the same time increasing the quality of care as well. Rather than 4 values a day, you have 1 value a minute, right? So that is a huge difference that it creates.
That is a huge difference. And I like the fact that you said, it gives people time to focus on the human aspect of care, because I think that's absolutely essential, and a lot of hospital staff tend to get bogged down really by the mundane aspect of it, and you also spoke to us just now about, international plans. Of course, there's a lot of work to be done in India. There's a lot of work to be done right here. You're very proud of being a Make in India brand, if I'm not mistaken. And of course, you've just recently, of course, got your US FDA clearance. So what does that mean going forward? Where do we see Dozee going forward in the next year, 2 years? Because this is a problem which is global, in terms of short-staffed, people, healthcare professionals being overwhelmed, as we've seen so much of late. So what are the plans going forward in that direction?
Absolutely. I think when Mudit and I started, I think almost 7 years ago, the fact was that we saw that 85 to 90% of medical devices, especially patient monitors, are imported in India, right? We don't make them here at all, right? And one of the problems with that is that we don't cater to the needs of a developing market, or we don't cater to the needs of a market where there's tremendous amount of patient load. We don't have the infrastructure that it is required. So how do we make the solutions that fit our geography, right? And that is not something that was being done. We were being treated as a secondary market, that this is a patient monitor that's available. If you want to use it, use it. And we only found the use case for it in an ICU environment, right? The rest of the beds, as I mentioned, were not monitored. And this is true for every other medical device component as well, right? Not just monitoring. So one of the factors that me and Mudit decided, and we wanted to challenge the status quo, we wanted to make in India, we wanted to make for India, but we wanted to make for global deployment, right? So it's not just an India product, because this is a problem that has been everywhere, not just Africa, Southeast Asia, Latin America, all the developing markets where we have seen that the manpower is even lower, the number of manpower is even lower, the infrastructure is crumbling, and the patient loads are through the roof, right? We have hospitals in India where patient footfall is 10,000 patients per day. This is unheard of in the Western geographies, right? And this is where we need to think of solutions ourselves. A solution that is made for India can definitely fit anywhere in the world, but a solution made for somewhere else may or may not fit in India, right? That was the thought process. And from day one, we wanted to make it for global markets, and the quality needed to be that. So FDA clearance is definitely a testament to that focus on quality that we had put, or quality management systems that we had put. We went through a rigorous application and interactions with FDA, having their feedback on our documentation, having their feedback on our quality processes, on the product itself. And we're very, very thrilled that we received the FDA clearance recently. In the next couple of years, we do definitely want to grow towards the emerging markets where the hospital products fit in directly, while exploring a fit in the Western markets as well, Europe and US as well. There is a good shortage of manpower. It's global. It's not just related to the emerging markets. And what we also are looking for in terms of growing in a product portfolio perspective, we're introducing home monitoring soon as well, in India as well, and in the Western market as well, right? So that is something in the next couple of years we want to take off. Definitely go over 100,000 hospital beds. A good chunk of those will come from India, at least 70% of them, but we do want 20 to 30% of them to come from outside India as well. India is our home market and will always be our priority, because this is where we feel direct responsibility towards the healthcare system, and we are on our toes to do anything that is required to go one step in the right direction. But yes, the hospital market in the next 2 years, a good chunk will come from emerging, like Africa or Bangladesh or Southeast Asia. And the home, we expect to find a good product market fit and launch this service from a home monitoring perspective, not just in India, but abroad as well.
Absolutely. So, that brings me to my final question, because I'm sure a lot of people who are watching this interview, have, people at home who are perhaps not in the best of health. They have to constantly monitor. You can't, always be going up and down to a hospital, things like that. So you want to kind of keep, and we saw all of this during COVID as well. Everyone wanted to almost create like mini hospitals in their homes. So with regards to the home services, when can we see that actually coming out? What will you have on offer? Is there anything you can share on that front as of the moment?
Absolutely. Very soon. The answer to that is very soon. So we are looking at it in a two solution point of view. One where self-management, people can take this device up, either use it themselves or for their parents or grandparents. Right? For example, I've been monitoring my parents for the last 6 years on Dozee. right?
Oh,
From this prototype that we had, that's
okay.
still under my parents, still working fine. And I get to see the data every morning and get to know that, okay, they're doing fine.
You're a very dutiful son, clearly.
Yes, and my parents also do appreciate it most of the time. Sometimes, but when it goes to asking questions that why is your blood pressure high, right? And
Yeah.
my dad would say, no, I had like food outside. It was a little salty, so I get to know these things as well that I did not.
Yeah.
Right. So that is something that we want to do very, very soon. Probably in the next month or so, we'll open it in Bangalore for a small beta, where we would want to test it with like early adopters, people that are interested in adopting technology, and especially people that are looking to take care of their parents, grandparents that are living away, right? Either in their hometowns or something like that. The other part is we've started working with hospitals on post-discharge care, right? And this is more specialized version of it, right? So specifically for a couple of hospitals, we are exploring oncology care. So between chemocycles, post-chemocycles, right? What are the harmful effects? Their immune system is at a low point right now. They're susceptible to infections. So any changes in their health patterns is very, very important to be notified to the doctor at the right time so that they can be called in the hospital at the right time for the right care, right? That can actually save lives if you address these issues at the right time. So not just cardiology, nephrology, we're working on specific verticals with specific doctors and hospitals on that, which is primarily aimed at post-discharge or more sort of a prescriptive care, where the doctor is involved and they are also monitoring the alerts that go from the platform, right? This is more of a managed care option, where your doctor is involved in that. And that this is exactly where you, as in the patient is going through some sort of a severe lifestyle disorder or something like that, right? So primarily two verticals that we're looking at. One is more of a self-managed care where you proactive user using it for your own health management or your parents or somebody loved ones health management, or else more of a managed approach where we go with hospitals and doctors and we enable that. But that's going to be more specialized one. So there more parameters can come in. We're also looking at to integrate more devices into the platform so that more and more it can get more richer in terms of identification of any sort of health deterioration. There, time is the key, right? So if you can get the patient to the doctor at the right time,
Absolutely.
that is what can create a lot of difference.
Absolutely. Well, thank you for creating a difference with the work you're doing and helping us all to have the right kind of wake up call to our health going forward. So thank you so much for joining us, Gaurav. Thank you so much.
Thank you.